Good evening. This is All India Radio, Kohima. I'm Ketholeno. The headlines. Prime Minister Narendra Modi to launch the first ever National Infrastructure Masterplan, Pradhan, Mantri, Gati, Shakti on 13th of October. Union Minister for Health and Family Welfare, Dr. Mansukh Mandaviya, emphasizes the importance of family, friends and relatives in having a good mental health. State Mental Health Institute observes World Mental Health Day. And Health Minister asked states to accelerate COVID vaccination pace to achieve target of 100 crore doses. As the nationwide free COVID-19 vaccination campaign at government facilities for those above 18 years is going on, we advise our young listeners to get vaccinated and also to help others to get vaccinated. We also advise our listeners not to lower their guard as COVID-19 remains a threat to our health. Please stay at home unless it is essential to go out and continue to follow these 3 simple steps. Wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene. For any COVID-related information and guidance, contact national helpline numbers 011-2397-8046 and 1075 and state helpline number 1800-345-0019. And now the news. Prime Minister Narendra Modi will launch the first ever National Infrastructure Masterplan, Pradhan Mantri Gati Shakti on 13th of October. The Gati Shakti scheme was announced by Modi on Independence Day this year. This will bring together 16 ministries, including 7 core infrastructure sectors, on one platform to synergize project planning across stakeholder ministries to avoid duplication, expedite clearances, and plug gaps at the right time. The Gati Shakti Master Plan will provide the framework for the National Infrastructure Pipeline Program and is aimed at making Indian products more competitive by cutting down the logistic costs and improving the supply chains. Union Minister for Health and Family Welfare, Dr. Mansukh Mandaviya, emphasized the importance of family, friends and relatives in having a good mental health. Speaking at the World Mental Health Day function organized by National Institute of Mental Health and Neuroscience, NIMHANS, Bangalore today, the minister stressed that our traditional family system, festivals and puja gatherings are means to having a good mental health. He regretted that changing family structures and lifestyles have increased mental stress in the society. He noted that the stigma attached with mental health prevents people from approaching the psychologists and psychiatrists, and hence the students and faculty in NIMHANS must approach the society and create awareness about the need to cope up with anxiety and stress. Health Minister in the state, Dr. Sudhakar, informed that NIMHANS has counselled 24 lakh people facing anxiety due to COVID during the pandemic. He informed that 1 in 7 persons in India have mental health issues. The State Mental Health Institute today observed World Mental Health Day on the theme Mental Health in an Unequal World. Principal Director, Health and Family Welfare Department, Dr. Nikhile Kimio, said that our society realizes the importance of mental health only when tragedy hits us. He said that mental health at every stage needs to be taken care of. Dr. Kimio pointed out that mental health issues have also compounded with the surge of COVID-19 pandemic. The director said that the state government and Health and Family Welfare Department in this line have taken up mental health programs with paramount importance. He informed that improved activities will be taken up covering all the districts in the state through the District Mental Health Program, which is now in place in only 6 districts. Senior Medical Officer Dr. Viketulie Piena said that scientific studies showed that mental health illness cases are common among lower-income families. He said that in the state, 80 to 90% of the cases are from lower-income families. Panel lawyer, Kohima District Legal Services Authority, Asenla Walling, informed on the availability of free legal services to persons with mental illness under the NALSA Legal Services to the Mentally Ill and Mentally Disabled Persons Scheme 2015 pertaining to judicial intervention and counseling. On the occasion, Deputy Chief Minister Pradhan urged all to emphasize the importance of talking about mental health and communicating one's feelings, as well as make continuous efforts to remove associated stigma. Let us pledge to be kinder to ourselves and the people around, Pradhan added. Health Minister Dr. Mansukh Mandaviya urged each state to increase their target so that the administration of the last 6 crore doses for reaching the mark of 100 crore is achieved in the next few days. He was reviewing the progress of COVID-19 vaccination with 19 states yesterday. Dr. Mandaviya noted that festivals, if not done in accordance to COVID protocols, can derail the containment of COVID-19. He said the twin-pronged solution is to follow COVID protocols very strictly and speeding up of vaccination. Power Minister R.K. Singh said that there will be no power shortage in the country and unnecessary panic being created. Meanwhile, the Ministry of Coal has reassured that ample coal is available in the country to meet the demand of power plants. It said any fear of disruption in power supply is entirely misplaced. The domestic coal-based power generation has grown by nearly 24% this year based on a robust supply from the coal companies. This news comes to you from All India Radio Kohima. You can also listen to this news on our YouTube channel AIR News Kohima. A total of 204 buffaloes have reportedly died from hemorrhagic septicemia in Melluri subdivision under Peg district. As a preventive measure, the district administration has ordered an indefinite blanket ban on import, slaughtering or butchering and transit of buffaloes within the subdivision. A DIPR report stated that a joint verification team led by Assistant Manager NSDMA John J. Odio undertook a 3-day on-the-spot assessment at Kanjang, Reguri and Akhen village from 7th to 9th October. As per the report, 112 bovine deaths were reported from Reguri village, 82 from Kanjan village and 10 from Akhen village, while several buffaloes are still reportedly missing. Medical reports undertaken on this regard suggested that the cause of death is hemorrhagic septicemia, a bacterial disease that mainly affects cattle and water buffaloes. The report also stated that 106 families have been affected by the calamity. Minority Affairs Minister Mukhtar Abbas Naqvi said that the next Hunar Haat will be organized in Rampur, Uttar Pradesh from 16 to 25th of October. He said that artisans and craftsmen from more than 30 states and union territories will bring their indigenous exquisite handmade products for sale and display. Naqvi said that Hunar Haat will be helpful in preserving and promoting the traditional art and craft of the country. Railways have successfully operated 2 long-haul freight trains, Trishul and Garuda, for the first time over South Central Railway. Long-haul trains, which are twice or multiple times longer than the normal composition of freight trains, provide a very effective solution to the problem of capacity constraints in critical sections. Railway Ministry said that Trishul is the first long-haul of South Central Railway comprising of 3 freight trains of 177 wagons. This train was started on 7th of October from Kondapalli station of Vijayawada Division to Khurda Division of East Coast Railway. The ministry said that South Central Railway followed it up with running of yet another similar name, Garuda, on 8th of October from Raichur of Guntakal Division of Manuguru of Secunderabad Division. Youth Affairs and Sports Minister Anurag Thakur said that sports federations should consult with the government first before deciding to pull out of big global events. Thakur remarks came as India's hockey team decided to pull out from Commonwealth Games 2022 in Birmingham to ensure greater focus on Asian Games. He said Hockey India should consult with the government and the sports department before taking any decision. And Nagaland today reported 8 fresh COVID-19 positive cases, taking the tally to 31,449. Dimapur reported 2 of the fresh cases, 5 from Kohima and 1 from Mogokchung. Total recovery from the infection increased to 29,505, with 25 recoveries reported today. no COVID-19 deaths were reported in the past 24 hours, the tally still remained at 671. Currently, there are 259 active COVID-19 cases in the state. To end the news, the headlines here again. Prime Minister Narendra Modi to launch the first ever National Infrastructure Masterplan, Pradhan Mantri Gati Shakti on 13th of October. Union Minister for Health and Family Welfare Dr. Mansukh Mandaviya emphasizes the importance of family, friends and relatives in having a good mental health. State Mental Health Institute observes World Mental Health Day. And Health Minister asks states to accelerate COVID vaccination pace to achieve target of 100 crore doses. That's all we have in this evening news bulletin. Good night.